Faith in Indiana is doing cutting edge work for Indiana's kids, working on reducing the incarceration rate and advancing investment in kids, and particularly pre-K. So they're out in front, and this is a awesome opportunity for us to get a chance to hear how they're doing, what they're doing, and also to hear from other people the things that you're working on in your states relative to this. So my name's Paul Marincel. I'm the lead organizer with the Healthy Hearlands Collaborative and the director of the PICO Center for Health Organizing. The Healthy Heartlands Collaborative started out 10 years ago as a group of 5 Midwestern states with public health officers and organizing organizations working together to begin to build a body of work that explored the potential for organizing to intersect with public health and for us to work together to tackle health inequities. Initially, that work around drawing those connections was in areas like the built environment and transit and more equitable development. It also began to move in areas of trying to impact childhood obesity. And I think we've reached a new point now, which I think is brilliantly exemplified by the work in Indiana, where the scope is really broadening. It's broadening geographically. So Indiana was not one of the initial 5 states, broadening geographically, but it's also broadening in terms of really opening up all of the, I'm going to say that, all of the field of the issues that our organizations work on and their health impact. So it's a tremendous moment, I think, in building this movement. Part of what we want to do in terms of the movement in 2018 is expand our approach to creating this learning community between organizers and public health. And we're going to be putting together webinars, case studies, profiles of action research that's being put together in order to really push this learning out into every corner of the nation. So there's no better place to start than with Jaward and the work in IndyCAN, Jaward Barnes. And we're going to start out with a Robert Wood Johnson Foundation video that Jaward was a part of, actually the centerpiece of, and then use that as a launching off point for your presentation, Jaward. So thanks to everybody for being on, and we're really excited that you're part of this conversation.
Yeah, good to be here. All right.
So you want to roll them, as they say, Janae?
All right, I'll go through the video.
This neighborhood is called Unwa, United Northwest area. It's just north of downtown in Indianapolis. It's hugely African-American, very poor. And every year in this neighborhood, about 236 out of every 1,000 men under the age of 35 will go to jail. It's an incredibly high number. And so you're in the middle of a neighborhood that is in crisis. IndyCAN is a movement for racial and economic dignity. We address issues that the most marginalized people in the community are facing. We do a lot of what we call listening campaigns, talking to people in the streets. We work with immigration, we work with mental health, and we also work on criminal justice reform. one of the things we do is a lot of research. And what we found was that 40% of all the people in Marion County Jail have a mental health diagnosis. It's a really bad thing because what happens is police are engaging people with mental health issues in the streets. People are arrested, they're put in jail, and so our jails are just inundated with people who either shouldn't be there at all or definitely shouldn't be there for the length of time that they're there.
This is James. He probably was 5 years older. James is my grandson. You see, he was a happy kid. See that smile? It's my baby. At the age of 19, his father started noticing his illness. He was just laying around the house and his behavior was different. He would get angry and curse and he talks to himself. It was hard to control. He was diagnosed as bipolar with schizophrenia. The first time he was arrested, he was arguing with his sister over $5. He said she owed him. They called the police because he got loud. And so they arrested him. And they took him downtown and kept him, I think he stayed 3 days. And
I want a picture calendar.
they let him out. And then he got locked up for trespassing. So it's just been, he gets locked up. They keep him 2 or 3 weeks. And he's not getting help. The locking up is not helping him.
The main problem with criminal justice is that there's no training for police and there's no facility to put people in, and there's no vision anywhere for mental health. And for instance, a few years ago, our mayor decided he was going to build a criminal justice center that was ultimately going to cost about $1.75 billion. Mental health was not attached to the plan.
They were talking about adding 1,500 more beds to the jail that was only aimed in locking up people. So we decided we don't need a jail. We need help for the mentally ill and the addicted. So we fought for that. We start calling people, we start engaging people at church, inviting them to meetings. And we met with the city councilman and I spoke and they voted against it. We won.
We build power through our membership, and it's our ability to move that policy through civic engagement, engaging city officials through our base that helps us to do great work for our community. And now nobody talks about criminal justice reform in Marion County without talking about mental health, without talking about transitional jobs, or having policemen take crisis intervention training. And so it's no more lock them up. It's all about how do we change the system long term.
IndyCAN, to me, gave us a voice. You know, grandmas and mothers and clergy. When those people come together, we can make a difference.
Hey. Okay, well, am I on now?
Yeah, it's on you. I'm gonna pull up the.
Okay. Well, I want to thank everybody for being here. Really excited about that piece, mostly because of the work that was done by the thousands of people in our organization here. My name is Reverend Gerard Barnes, Urban Strategies for what is now Faith in Indiana, and I direct our Live Free piece, which is, of course, is the strategies for urban movements. And my job has been enhanced greatly in this mental health piece in particular. Of course, I have my own story of but I have an uncle who, at the end of this piece, it kind of struck me just now, who did 22 years in the Air Force. And when he came out of the Air Force, something had gone on, and he was having incredibly incredible episodes, psychotic style episodes, periodically, and there was no help. And I remember the only thing that we were able to do was that people were able to do was call the police, and the police would come and arrest him, and they'd take him to jail, and they'd keep him for 2 or 3 days, and they'd bring him back, and there was never any help until we began to really investigate what were the possibilities of this incredible hero to our country who did 22 years in the Air Force and served his country and raised 2 beautiful daughters and married to a woman for almost 50 years. What would it look like to have a plan for his life? And we began to move an agenda forward that took him from living in the basement of a church and got him some mental health care. And now he's down the road. He's in his 80s now, and he has his own home, pays his own bills, and is taking good care of himself because he received mental health. And so people were being criminalized because of other issues. And of course, his daughters from a young age were traumatized by his issues. And so it's been a very big thing for us to move forward. So I want to move to the next slide, if we could, and just begin to, I think there's the next one. Oh, am I supposed to do this? I got it.
No, they're doing it here.
Okay. Yeah. I think one of the things that is important is that Indiana is this incredible organization, is this incredible state that has been really based on family values, and but yet the number of children in Indiana and separated from their parents because they're locked them behind bars is nearly topped by just very few states in the nation. We are in the top 4 or 5 states in the country with children who have at least one of their parents incarcerated in their lifetime. It's just an incredible amount of things. But also, what we also have noticed is that there was no place to put people. And so 40% of inmates have a mental illness, 85% have substance use or disorder, and mostly been used in jails to warehouse the poor, the sick, and addicted. And it's also, if you flip to the next, it's also been incredibly racialized. You can see here that 1 out of 4 Black people can expect to be incarcerated in their lifetime here in this state, whereas 1 in 173 white people can expect to be incarcerated in their lifetime. That's an amazing disparity, and it really has a lot to do with what has set us up for our children to be traumatized by parents being missing. So the quality of early childhood education then has been a well-documented predictor of future success, but yet less than 2% of eligible 4-year-olds have access to that here in our state. So that's part of our fight. So Faith Indiana and our IO partners are really believe that incarceration should be a last resort. And we should invest in policy to keep families together. We should be moving toward an out of jail and give our most vulnerable children a hand up and just a way that they can survive by not overwhelming their lives and taking them out of the game. We've been really moved by the incredible work of Pope Francis. We are a faith-based organization, and he said something that I found very powerful. Particularly when he kind of burst onto the scene a few years ago with this sort of I call it a back to the future approach that he has. And he said any society, any family which cannot share or take the pain of the children and views that pain as something normal or to be experienced, he said these words. He said, that's a society condemned to remain a hostage to itself. And so our work has really been steeped in how do we move a group forward or our efforts forward so that we're not that. So then we have over time engaged in some plausible approaches to how we do it. Our goal has been in our work as we've talked to the mayors, of our city. In the past 4 years, we're on our second mayor, that we would have a 50% drop in incarceration, and that we would double access to quality pre-K for our children. So with support of course the RJ the Healthy Heartlands movement in Indiana, we teamed up with two researchers over at IU, Karen Ruprecht, Director of Innovation at Early Learning Indiana, and Angela Tomlin, Director of Riley Child Development Center at IU Medical Center. And we've been talking about a unique project designed to address the social and emotional and developmental health impacts of over-incarceration on our children, and how it has undermined people's ability to participate not only as adults in this economy, but as children in just having a life that all of our children easily deserve. So the goal of this project by 2020 has been to equip communities directly impacted by incarceration to inform policy decisions, to drop Marion County's incarceration rate by 20%, and expand access to high quality pre-K to low income communities of color with high levels of parental incarceration. And I want to share with you some strategies that we've done. We've been really excited about some of the work we've done. And so there are some ways we do this. So the first way we do this is to make sure that everything we do is community driven. Often when we say community driven, we mean that there's going to be maybe a focus group, or we're going to ask some clients. That's not what we mean by focus driven. What we mean, Faith Indiana is run by people directly impacted. That's the model that those most affected would actually run even to our board. Like people like if Chelsea was here, whose father was incarcerated because of a mental illness. We got 500 community teams and constant relationship with thousands of people. Faith in Indiana leaders, we collected over 1,000 culture of health surveys and engaged 1,200 people in town hall strategy meetings, and not shaping the research design, but building support for policy change. And this has been a huge part. As you can see, it's always been multicultural, multi-faith. We embrace the 17 largest denominations in the state of Indiana, and there's been lots of intentionality about that. Second thing we deal with is equity focus. In Faith in Indiana, we are very clear that we have put race at the center of our work. Research shows that universal programs do not create universal results. So it can't just be something that's just thrown up against the wall, but it's a really focused approach on exactly who we are after and to be transformational. Example, universal health care, universal pre-K, mass incarceration. People are situated differently in the system. We're putting equity at the center of the conversations, or the most vulnerable are definitely always prioritized in our work. And we're excited that a picture there is at our recent summit that we had, where we had people from around the nation come in, and our youth showed up in huge numbers. And then action-oriented. We understand that power is about organized people, organized money, and organized ideas. It's not enough to have a good idea or solid research, because it doesn't translate to improved lives or new systems. That requires building people, building community power. In the first year of the project, our collective organizations have engaged over 120 legislators, policy experts, and public officials about the public health impacts, mass incarceration, and early childhood education. We've generated 70 plus media hits. It's more than that. It's about 113, I think, plus media hits to advance our culture of health narrative. And we reached over 200,000 through our communications and mass media. So it's been a serious approach to really open up the idea that if we can, it can move forward and really keep our action going forward and keep our officials engaged and have our people engaging our officials, then we have a great opportunity to make change. And then, of course, leadership invested. IRL is investing in multiple level leadership change at individual, ecosystem, and systemic change levels, and we are certainly a part of that. And so we're continuously being invested in and continuously investing in our people on policy and systems, ecosystems, and the individuals, so that there's a real understanding together that we build this power as a group to get exactly what we need to be transformative in the world. So you might say, well, what have been the results? Well, the results have been pretty good. We were able to, that piece you saw at the beginning was part of a criminal justice reform package that fight that we were in, that we won. And the key was, we have a different mayor since then, but the key was not that we were able to shut down that jail, which we were. The key, because a new jail would just come. The key was not about changing regimes or shutting down jails, but it's, can we actually flip the narrative to where the conversation in the region has completely changed. So prior to this, the conversation was always about, well, bad people need to be locked up, and so we need extra beds to keep locking up because that's going to keep happening. Our goal was to change the narrative to where people stop saying lock them up and have a conversation about what it means to be transformative in this region. And so what happened was our new mayor just agreed to, they appropriated $20 million for a criminal justice overhaul. That's just for the planning to build a criminal justice center that they have already begun to plan, that will have mental health facilities separate from the actual jail, that will house up to 300 to 500 people that will not be arrested, but that will be taken directly there and assessed. We have EMT teams where policemen have actually gone into certain neighborhoods already. It's a training where we have a police officer, a EMT worker, and a mental health professional in a car. And in their first 200 calls, they only arrested one person and took them to jail. We have our Supreme Court. We, in the midst of that fight, we're fighting on pretrial release. We're fighting on the over-incarcerated and the poor people being thrown away. And we were able to win with our through our fight, through, of course, lawyers and people and judges, to end cash money bail in Indiana. So as of January 1st of this year, money bail in all 92 counties for misdemeanors has been discontinued in our state and is no longer an issue. Of course, we have ongoing fights, but we're really excited about that. $22 million pre-K expansion. And then, which we're really super proud about. There's a lot of work that's going to be done to transform the lives of young people and their families around them, and so we're excited. And then 27,000 newly eligible 4-year-olds that there's been expansion of people who are going to be eligible, and families are going to be eligible to actually participate in a process that's going to change their lives forever and can be impacted early on. And so the fight continues and the struggle continues. And so one of the main things about this is that we stand together, we pray together, we meditate together, we want to leverage impact and access sectors, which is one of our lessons. We apply relevant research and data to increase the increased impact of community work, to make sure that that's always a powerful part of our work, but not just a research project creating conditions to drive improvements in the health of communities, but that our communities would then own it for themselves, and that they would walk and work together in unison, in unity, and move and impact the entire region. Invest in community leadership to address systemic change through community organizing that has a capacity to build political will. And that's at the center of our work as we move forward. I'm gonna end here and open the floor. I feel like I've talked long enough. And so if there are any questions, we certainly are here to do what we can.
Fantastic, Jawad. So I got a set of questions. Let me start. So what kind of openness did you find to health analysis when you started talking with public officials, either about the early childhood work or the reducing incarceration work? I mean, how did they respond initially to this health framework?
Yeah, that's a great question. The framework I think, first of all, I want to say that the key to this whole thing is organizing. I think organizing changes it because nobody was hearing that, understood that concept, or got it as a real framework and a real thing. And so what we were able to do was, for people in political power, or constituents. And so what we were able to do was do just a load one-on-ones and build will amongst our groups and within our teams, our community teams, our faith teams. And then we mostly have those conversations with officials through research actions, and sort of have a back and forth with them there. So they're in a room with a group of community leaders and people most impacted, who have been schooled on these issues and have had conversations about these issues, and are able to hear the real testimonies of people who are impacted, and then to hear the empirical knowledge through that lens.
How the new political landscape has been, how has the new political landscape been impacting your work?
Okay, I think somebody's asking. Paul, first of all, are you good with that?
Yeah, that was great. I got to follow up, but I'll come back to it. Let's take this other
Oh,
one.
okay, I got to put my glass. Okay, Adrian's going to help me. What is that?
Monica asked how the new political landscape has been impacting your work.
Yeah, how the new political landscape has been impacting our work. Okay, that's a really good question, Monica. It's always, I've always said that your strength and your weakness are always the same thing. And it's been really powerful to see that it's been an opportunity to understand, first of all, the intentionality of most Americans to really be free, and the calling on people's lives that they see to move forward. So it's been really an opportunity to really understand the soup in which we swim in this country, and how white identity has been tapped into so completely in this era. But to find out that that's not just the most horrible thing, because what it's also been able to do is help us to have conversations between rural and urban people, and to have and to create dialogue where people can see themselves as not less than or more than, but see themselves as having some shared identity. And so it was, of course, surprising to us all this past year, but we've been able to turn it into an opportunity to have. I'm going to Elkhart, Indiana, and when I leave here, it's about 3 hours north of here, and to meet with a group of clergy tonight. And it's really powerful to have Mennonites and Black Baptists and people who live in where they're actually still driving carts. I mean, and driving wagons, and Eggman is still coming with guys that are driving, nice cars, and have these conversations about what do we have in common and what's making us work. So yeah, it was tough, and it's been tough, and it will be tough in a lot of ways, but it's also, I think it's an incredible opportunity to move this country forward, to have some real serious conversation about what identity is.
Kate asked, how can other nonprofit organizations and other agencies offer support to this work?
Wow. Paul might want to help me on that. We can talk about the overall work. Paul, I'm going to defer to you, and then I'll follow up with you with that.
Well, I think it's, I'd underscore something, Gerard, that you said throughout your presentation, which was, this is about organizing and about building power. Mm-hmm. So I think a key thing for public health officials to think about, some of whom are on this call, and for nonprofits, is how do we establish honest, robust relationships with community organizations that are building grassroots multiracial power.
Yeah.
Because I think that alignment between power building and, quality research and some of the social service sector, that's where we're going to have a chance for some breakthroughs. That'd be my reaction.
Yeah, I love that, because the whole issue is going to be through the organizing. If we don't get narratives that are being changed and transformed, we'll just have regimes come in and just hold on to the same things. And so I think it's key to organizing and really buying into the idea that you can make a difference is where it starts. And then of course there are lots of tangible things we can do.
The next question is from Kevin, and he asks, are your plans to take this model to other communities throughout the U.S. experiencing similar incarceration disparities?
Are your plans to take this throughout the U.S. experiencing other? Well, the answer to that is absolutely. I think we are. I think that's what this health. I think the Healthy Heartlands approach is about cities and the opportunity for cities to participate in their own healing. I think I was in a room with a lady. I was doing something a few months ago, and she said, "So what do you all do? Help people?" And my answer to her was, "Absolutely not. We're not interested in helping anybody. Everybody's in a fight together." And we're all in here. Our job is to create an atmosphere where we're all very powerfully connected, and being change agents in our cities with the information that we gather, and then with the way we distill that and the way that we move our people into spaces that we actually can create these moral electorates around, because that's really what it's going to take around the country. But it's steeped in people understanding what the issues are, being very clear about it, and it's not about emotional responses. It's about the reality of our nation. So yes, we are taking it across the country. Like I said, and one way of doing it is Healthy Heartlands Network, and other areas other ways that we're doing this. Yes. Criminal justice reform, violence reduction, all that.
I would add that we're very interested in 2018 to build out the strategies and tools that people can make use of across the whole organizing field and the public health field. So this webinar and the webinars we're going to do are an experiment in that process. And we'd be really interested in people's feedback about that. In addition, though, we're going to be putting together case studies. We've already done one on the Preschool Promise campaign in Cincinnati that laid the groundwork for a huge referendum to put more money into preschool, and is now setting the stage for a statewide preschool campaign in Ohio. So we're going to be writing case studies about each one of these, and we're interested to see what people will find most useful in terms of using those case studies in their own communities. We're also part of a Robert Wood Johnson Interdisciplinary Research Leaders project that Jaward has been participating in, along with Shoshana, his co-director. And they're doing action research projects right now, 15 a year, each year, new teams. And we're going to be writing up preliminary profiles of that action research and trying to push that out and into people's hands as well, all with the intent of giving people tools that they can use to build these alliances inside their own states.
Thank you for that.
Jaward, I want to ask you one follow-up question from when you were talking about dealing with public officials. You said it's basically an organizing proposition of one-on-ones, research meetings. Were there any, back to this tool question for a minute, were there any tools that were useful, or now, you know, as you've moved forward in this process, tools that you think would have been useful? Health impact assessments, you know, the video that you just showed us from the Institute of Medicine, that kind of imprimatur. What do you think? What worked in terms of underscoring your credibility, and what would you add to the list that we should be developing?
I think the tools were super important. I think having best practices, having the research, like when we began to talk about what would work around criminal justice reform and about what worked for our children, we began to study other cities and other research that was available around the country, like what was going on in San Antonio, for instance, was very powerful in terms of helping us to understand how they had flipped the whole thing in 18 years, and all the numbers that had dropped through the research that they had been able to show us what was going on in New York and DC with in terms of so it's been the work we use. The very institute, they're very important. They've been very important to us. Organizations like that, University of Wisconsin, they did a lot of research for us. So just having the issues of what has been the impact on to have impact on who's being killed, who's being thrown away, which in terms of race, you know, in terms of gender, in terms of what their economic status was. And so all that information is, I mean, it's sometimes, I mean, we just had a staff meeting, it would have blown you away. I mean, we just had so many drafts, so many charts, you know, just to know, because you can't do this work if you don't know who to target. I mean, we're being policed sort of randomly. And I think we can help police forces and what have you do good work if we have real good data on where their issues really are and what's really going on. And it's really helped us. We're in a relationship right now, our police department, our mayor, around violence reduction, and that's part of the thing we're using. It's these same children that have been impacted. And so instead of just randomly approaching people, we know who's likely to be in trouble violently or economically or educationally. And so the all the information that gives us data as it relates to race, income, marital status, all those issues we use all that information and compile it, and then it helps us to put together a plan and to sit down so that when we're talking to political officials, we're not saying something they can go back and say it's not quite that way. And we even get knowledge that, you know, and we don't just do one thing, we do several things so that we're ready for whatever pushback they may have for other types of research that's coming. So at the center of our work is to take the very valuable and important work of research that's been going around the country, and it's always at the center of our work. Was that what you're asking?
That's great. Thank you very much.
Sure.
Gerard, this is, excuse me, this is Sue. I just wanted to ask, because in the video, I found very compelling this woman's story about, I can't remember if it was her own son, but anyway.
Her grandson, yeah.
Her grandson, okay. So tell us a little about the use of personal stories in some of the work that you've advanced.
Oh yeah, we never do anything publicly without bringing the personal stories. I mean, that's the heart of it. People have to know that there are people in the room that have really been affected by it. I mean, that's sort of the center of our work, that the people most impacted would lead. And so Sharon Trotter, who you saw there, her grandson being so heavily impacted with mental illness, we have people like her who's a minister in one of our churches, and the thousands of people like her, all of whom have similar stories or something different about their impact. Whenever we walk into a room, first of all, even amongst ourselves, to remind ourselves that this is real stuff and not just things that we can talk about, but people are really experiencing this, and we see these people every day, all day, and in fact, they're us, you know. And it keeps us out of that mindset that we're helping somebody, and that because that's not what we're doing. We're not social services, we're social justice, and we're in it together. It's a fight together. So it's our people being demonized and killed and thrown away.
All right. Any other questions? Jawad, I'm gonna thank people, and then I'm gonna give you if you have a parting shot you want to give us. So I want to thank everybody for being part of this, and we welcome your feedback, not just about Jawad and the content, which was fantastic, but how we approached it, what would be more useful in the future. But thanks, Jawad. I really, really appreciate the work you're doing and taking the time to make it available to the rest of us. You have a final comment you want to make?
Well, I want to thank everybody for the hard work that you're doing, for the researchers, you definitely are helping to drive this work, and we're excited about the partnership that our Wood Johnson Foundation is doing and Healthy Heartlands for us to work together. I honestly think we actually can, as one of our bishops and our political director in DC said, I think we can really change the damn world. And I think if we really go ham and just stay focused, that no matter what the political environment is, the regime is less important than the narrative. And we can create a narrative, and that narrative will rule the day. That's organized.
All right. Thanks to everybody.
Thank you. All right. Bye-bye.
Take care. Bye-bye.